Hi, my name is Paula Bitter, and I'm going to discuss the grant that is available for rural health care in Kansas from the United Healthcare. I'm also going to provide a little information about the community I live and work in. First, let's answer the question, what is grants? According to the Agency for Healthcare Research and Quality, grants are awards to organizations to improve the quality, effectiveness, accessibility, and cost-effectiveness of healthcare. Geographical, racial, and ethnic disparities in health and healthcare, and the need for healthcare systems to accommodate increasingly diverse patient populations are a matter of national importance. As solutions are sought, it becomes more important to involve the areas and groups most affected by the disparities. Okay, then why should nurses be concerned about grant writing? The DNP nurses are in a unique position to use principles of economics and finance to redesign effective and realistic care delivery strategies in order to conceptualize and implement new delivery models based on contemporary nursing science. DNP nurses should develop grant writing skills for many reasons as listed here. Just remember, critical thinking skills possessed by DNP nurses can ensure the scientific quality, practice relevance, and value for return on investments that are infused into the grant proposal. There are many different types of grants. Private foundations will often fund projects and proposals that other funders will not. The application process is easier and shorter than research or government-funded grants. It's often usually more flexible. Private foundations were probably formed by wealthy benefactors who wished to reduce their tax burden and fund projects and organizations that furthered the interests, values, and belief works and the life works of those individuals. It is important for the grant seeker to understand the mission, vision, and values of the proposal so it syncs with the funders' mission, vision, and values. Research grants fund health research projects. These types of grants are very competitive, and the competition for these funds is only likely to increase with the numerous individuals and groups conducting research projects. Most research funding agencies use a structured application form, employ a method of electronic submission, and require a clear, concise writing by imposing word or page limits. Private industry grants have been very appealing to DNP nurses in the past. The thing to remember that the guiding principle of corporate charity is the concept of self-interest. The basis for the corporate giving is based on the Internal Revenue Act of 1935, which made it legal for corporations to deduct up to 5% of pre-taxes for charitable contributions. In 1953, the New Jersey Supreme Court ruled that corporate contributions for purposes other than a direct benefit to the business are legal. Government grants may be funded as federal, state, or local or city grants. Government grants are probably among the toughest funding sources to pursue and to receive. Applications are long, complicated, and both time and resource intensive. Requirements vary from agency to agency and program to program within the government. There's usually a short response turnaround time frame, such as 45 to 60 days, and in addition, there's a longer review process, such as 3 to 6 months. Grantees are required to submit frequent reports, keep accurate project records, and agree to audit and site visits by government personnel. Applicants run the risk of writing proposals that require more than the person or organization can support in order to meet the demanding grant requirements. Funding is often very competitive, with little provocation for grants to be dismissed. So we're talking about rural areas. Why are there grants designated for rural areas only? Well, it provides a foundation for additional funds for projects that could be possibly combined with other funding sources to support a project. Community needs are determined by community health assessments conducted at a county community town hall forum. It provides the needs the community deems important. It provides assistance in allotting assets for specific community. It provides opportunities for networking for these communities and organizations within a community, and it reduces the cost for services, equipment, education, community assessments, technical assistance, building updates, etc. for communities and organizations. There are, however, barriers to rural health grants. According to Rural Health Information Hubs, these include in part lack of major foundations located in rural areas, leading to fewer networking opportunities, the ability to show potential impact to funders when serving less densely populated areas, perceptions that rural projects are less sustainable and organized, and that there is a weaker local nonprofit infrastructure. In addition to those barriers, the amount of funding being allocated to rural organizations is significantly smaller per capita when compared to urban communities. According to the Rural Health Information Hub, organizations based in non-metro counties receive less than half the amount per capita compared to organizations in metro counties. So now let me discuss a little bit about the county that I work and live in. I live in Russell, outside of Russell, in the country, so I live in Russell County. Here are some statistics provided by the U.S. Census. The total population of Russell County as of 2016 was 6,970. There are 886.26 square miles, which means this equals 7.9 person per square miles. The county seat in Russell County is actually the city of Russell, which is basically geographically located almost in the middle of the county. The median age is 47.4, with 22% of the population under the age of 18 and 23.1% age 65 and over. There is also 11.4% that are age 75 and over in Russell County. There are 14.5% living in poverty, which is a slight increase from 2015. There is also a 10.7% of the population under the age of 65. There is one hospital located in Russell. It is a 25-bed critical access hospital that has a 24-hour emergency room. Currently, the hospital is in an expansion phase to increase their physical and occupational therapy department, increase the size of the physician's clinic, and make room for services provided by outreach physicians. As of this time, the outreach physicians are housed in another facility away from the hospital. There are 4 doctors, 2 APRNs, and 4 PAs practicing Russell. There is one health department that has 2 RNs and a Healthy Start home visitor, and offers many different programs from WIC to family planning to adult services such as dietary consults, education, blood pressure and blood sugar screenings, to injections and other things, just to mention a few. The child care licensing surveyor is also located in the health department. According to the community assessment conducted by the hospital and the health department in 2015, the needs of Russell County consisted of access to preventive health care services for all individuals, affordable family planning/women health services for all women in Russell County, behavioral health services availability, travel, especially for those outside the city limits of Russell, and healthy food options for pregnant women, infants, and children under age 5. The WIC program provides nutritional supplementation for this cause. United Healthcare provides a grant specifically for rural and frontier community programs. The purpose of this grant is aimed at improving health resources and programs for Kansas residents living in rural and frontier areas. The funding agency is the United Health Foundation. Their mission is helping build healthier communities. According to the United Healthcare website, United Healthcare is dedicated to helping people nationwide live healthier lives by simplifying the healthcare experience, meeting consumer health and wellness needs, and sustaining trusting relationships with providers. You can read that they have contracts with many physicians and care professionals and over 6,000 hospitals and other care facilities nationwide. Their beliefs is that they can, through their unique partnerships and the strength of the people, they combine knowledge, experience, and passion to improve the health of the communities where they work and live. They are dedicated to investing in a future health workforce that meets the needs of tomorrow and supporting initiatives that improve health qualities and outcomes. This grant was developed following a brainstorming session that brought together healthcare providers and other stakeholders from across the state of Kansas to develop strategies to address the issues of improving health resources and programs for Kansas residents living in rural and frontier areas. As you can see from this list, there are many reasons why this grant is focused on rural and frontier areas of Kansas. I would like to point out that the last one, where it says the number of Kansas children living in poverty increased by 3.8%, that kind of correlates with the increase in poverty of the population in Russell County. Here is a map by the U.S. Census that depicts what is a frontier county, what is a rural county, etc. As you can see, Russell is at 7.9 persons per square mile. Ellis County, where Fort Hays is listed or located, is 32.1, which makes them a densely settled rural area. The priorities of the grant are very specific as listed here. This grant will support organizations working to address these healthcare issues and the needs of people in their community. The organizational criteria is listed here. Basically, the entity receiving funds must be located in Kansas and a nonprofit or governmental or public agency. The specifics are not listed on the United Healthcare Foundation website. If an organization or community is interested in this grant, they must request information from the email listed here. Once they receive the grant information, they can then begin their proposal and the grant application process. It is important to complete the grant application as directed, including the detailed narrative and the goal of the project. Information about the community must be included with the narrative, such as the demographic, health status, location of organization, distribution of healthcare workforce, data related to specific population groups, and information about transportation and access to healthcare. To make the application more appealing and thus more likely to be funded, it is encouraged to collaborate with other organizations within your community. Other information to be included is detailed budget narrative, specific plan and timeline, financial information such as the DUNS number or your federal tax ID number. It is also important to have a sustainability plan. Funding organizations want to know how the program is going to continue after their funding has ended. Other supporting documents required of the grant also need to be provided. This grant will award initial grants ranging from anywhere from $40,000 to $50,000, which then can be renewed at the end of the grant cycle. This grant will also provide funding for programs that are already established. In addition, if there is a one-time project that needs funding, this grant will also fund that one-time project that lasts up to 12 months. Allowable expenses are very specific. Here are a few of the expenses that are allowed for this grant. On the flip side, funding exclusions are also very specific. Here is a list of some of the funding exclusions for this grant. The grant is very detailed. The deadline for proposals was February 17th, 2017, and the funding agency notified awardees by April 28th, 2017. Agreements are signed by the grantee and the grantor. The grantee agrees to submit budgetary and program updates quarterly. The grantee may also wish to reapply yearly and more than likely will be funded unless the grantee neglects providing the necessary or required information or anything else that goes against the grant's direction or chooses not to apply. The grant cycle is a continuous cycle that involves different organizations with the community, such as healthcare, health department, business leaders, educators, government, and so on. And here is a list of my references. And I want to just wish you a very Merry Christmas and a Happy New Year. Thank you.